Cystic Fibrosis by Jennifer Hernandez, Edna Candela, and Mary Bird.
Cystic fibrosis is a hereditary disorder characterized by lung congestion and infection and malabsorption of nutrients by the pancreas.
What is cystic fibrosis? This is a life-threatening disease that affects the lungs and digestive system. About 30,000 people in the United States are diagnosed each year. Many people with this disease inherit a defective gene that can cause a buildup of thick mucus in the lungs, pancreas, and other organs.
Signs and symptoms of cystic fibrosis. You have very salty tasting skin, persistent coughing, sometimes with phlegm, frequent lung infections such as pneumonia or bronchitis, wheezing or shortness of breath, poor growth or poor weight gain in spite of good health, frequently greasy, bulky stools or difficulty in bowel movements. Small, fleshy growth in the nose called nasal polyps are also one of the symptoms.
What causes cystic fibrosis? Cystic fibrosis is a genetic disease that is inherited from the parent's genes. It is caused by mutations in the genes that produce a protein called cystic fibrosis conductance transmembrane regulator, or CFTR. This protein controls the flow of salt and water in and out of the cells of organs like the lungs and the pancreas.
Diagnosis: genetic testing that can be performed prenatally if parents are known to be a carrier of this genetic mutation. Family history, a pulmonary function test, radiographic chest film, stool studies, a sweet test which revealed elevated levels of sodium and chloride that confirms the diagnosis.
How is cystic fibrosis treated? Cystic fibrosis is considered a fatal disease. High calorie and high sodium chloride diet, chest physiotherapy, vitamins A, D, E, and K supplements, increased fluid intake, and pancreatic enzyme supplementation to help the digestive system. How is cystic fibrosis treated? Treatment for lung problems include antibiotics to prevent and treat lung and sinus infection, inhaled medications to help open the airways, flu vaccine and pneumococcal polysaccharide vaccine or PPV yearly. Lung transplant could be an option for some cases. Oxygen therapy may be needed as lung disease may worsen. Therapies to thin mucus, which make it easier to cough the mucus out of the lungs.
What should be avoided? Exposure to dust, dirt, household chemicals, smoke, fumes, fireplace smoke, mold, and mildew.
Genetics. There are more than 1,200 known mutations of the CFTR gene that can cause cystic fibrosis. Genes are inherited from both parents, and in order to get cystic fibrosis, you have to inherit the gene from your mother and father. About 4% of all Caucasians are cystic fibrosis carriers. If both parents are carriers, there is a 25% chance that the baby will be born with CF.
Who is at risk? Cystic fibrosis affects both males and females. It affects all racial and ethnic groups. It is most common in Caucasians of Northern European descent. It is also common among Latinos and Native Americans. It is much less common among African Americans and Asian Americans.
Prevention. Cystic fibrosis cannot be prevented. Screening those with a family history of the disease may detect that cystic fibrosis gene is in many carriers.